So let's talk about fibromyalgia. In my 24 years experience in practice, I've probably had more fibromyalgia cases than any other condition, really. And I think the biggest reason is because medicine doesn't really offer a whole lot of help for most fibromyalgia patients. So a lot of them are desperate, they're searching, and unfortunately they get here after they've run through the whole medical gamut, tried everything else, and it didn't work. But the good thing is our success rate with fibromyalgia is probably better than any other condition. Now, why is that? Well, let's get down to the cause. Where does fibromyalgia come from? Well, one of the reasons medicine doesn't have much success is because fibromyalgia doesn't come from a drug deficiency or too many body parts, right? So taking a medication, although it might mask the symptoms temporarily, it's never fixed the problem, right? Never fixed the cause, because the cause, from what I have found with fibromyalgia, is coming from somewhere else. And to be specific, that's the upper cervical spine, the top bones in the neck. This is a very important area when it comes to fibromyalgia because two things. One, the head sits on top of these two bones. So wherever those bones go, they take the head with it because it literally just sits on top and doesn't have any choice. So if one of these bones got misaligned, in most fibromyalgia patients, they have some sort of a trauma in their past, maybe a car accident, maybe abuse, maybe a fall, maybe a sports injury, something that could have shifted one of the upper bones in the neck to the point that it took the head a little out of balance. Well, your brain's designed, it has to be level always. It has its own reflex, it's called the righting reflex. And its whole purpose is to make sure the head's always right or level. Now, why is that? Well, the brain's the control center, right? It sends the messages to your heart, your liver, your lungs, your kidneys, arms, legs, everywhere in your whole body. Starts in the brain and then travels down. Well, if one of those bones get out of position, throwing the head out of balance, your brain will respond by sending messages, forcing your body to compensate till that head levels. So just to give you an example, let's say the bone moved this way, out to my left. So to get my head level, it might cause me to pull down a shoulder, pull up a hip, ultimately pull one leg up shorter than the other. So what that does is it creates compensatory changes through my spine. Now, with gravity pushing down, just going through normal motions, over time those compensations can become weak spots. They can turn into neck pain, upper back, shoulder pain, lower back pain, hip pain, leg pain, knee pain. It can affect the nerves that go down the arms, the nerves that go down the legs, like sciatica. It can cause the discs that are lined up between the bones to bulge to one side or the other, affecting the nerves down the legs and down the arms. So you can imagine how this could create a lot of musculoskeletal conditions, right? A lot of aches and pains throughout the body. Now, another very, very important thing is most fibromyalgia patients don't sleep very well, right? You can call it insomnia, but you don't rest well, okay? Now, the sleep center resides in the heart of the brainstem. The brainstem lies inside the upper cervical spine, inside the upper two bones in the neck. So if one of those bones get out of line, they can literally interfere with your sleep and how well you get into deep sleep. Now, how does that affect muscles in fibromyalgia? Well, your body recovers in deep sleep. If you never get into that higher stage of sleep, then your body never fully recovers from the previous day. We see that a lot with fibromyalgia patients. It would kind of be the same as you going to the gym and doing bicep curls every day, without actually giving those biceps a time to heal, because we're constantly fighting gravity, just standing here, walking, moving, we're constantly using muscles, postural muscles to hold us up. Well, if those postural muscles don't have an opportunity to recover and to heal, then they get sore. They get achy. You have chronic lactic acid buildup in the muscles, creating those same aches and pains as commonly found with fibromyalgia. Now, the other side of that brainstem, what makes it so important is not just your sleep, but every message from your brain to your body goes through the brainstem, goes through the upper cervical spine, goes to the heart, liver, lungs, kidneys. Well, a lot of fibromyalgia patients have digestive problems like acid reflux and irritable bowel syndrome or constipation or diarrhea. So we see that quite frequently as well with fibromyalgia patients. As we remove the pressure off the brainstem, messages start to open up and we see those things start to improve as well. Energy levels. You know, a lot of fibromyalgia have the chronic fatigue. Well, if you're not sleeping well, obviously you're going to have fatigue as well, right? So that's how, and after time, you know, it even affects how the brain operates, can affect things like depression, anxiety, panic attacks, right? Can create ringing in the ears like tinnitus, okay? Fluctuations in hearing, balance issues, okay? All from just that little bone in the top of the neck. All of these are symptoms that we see quite frequently with fibromyalgia patients. So what do you do in order to quit chasing the symptoms and finally get to the bottom line cause of your fibromyalgia? Well, you have to see an upper cervical doctor, because they've got to be able to do an exam and evaluation to determine, is there a problem in the upper part of your neck that could be creating your fibromyalgia? If so, hopefully they can correct it. Now, if you live in the Charlotte area, that includes Pineville, Mint Hill, Belmont, Ballantyne, Rock Hill, Fort Mill, Huntersville, Cornelius, Davidson, all Gastonia, anywhere in the surrounding area. We have patients, our average patient drives about an hour each way. Give our office a call at 704-588-5560. Let's set you up. We don't charge for a consultation to find out what your needs are and to find out if we can help you. Just call our office. Cynthia or Susanna will be happy to set you up to come in, talk with one of our doctors, and let's see what we can do to help. Again, if we can help you, we'll tell you. And if we can't, we'll find another specialist that we think that can. Now, if you don't live in the Charlotte area, try to find an upper cervical doctor near you. Google it. If you're having a hard time in your area, give our office a call. We'll do our best to set you up with an upper cervical doctor near you. Again, if you do live in the Charlotte area, give our office a call or visit our website, www.uppercervicalspinecenter.com, or call the office, 704-588-5560. We'd be happy to sit down and find out what's causing your fibromyalgia once and for all and see what we can do to get your life back.